Hello friends, welcome to Prosto Hub and myself Dr. Jolsna. So today we are going to start off with a new topic which is one of the most important topics in prosthodontics, and you should never miss this topic while preparing for your university exam, and that is articulators. So here are some of the important questions that I have come across about articulators in university question papers. You can see that articulators have been asked for 75 marks long essay, 100 marks long essay, even as 20 mark short note or 10 mark short note. So articulators is one of the must read topic, and I repeat, you should never miss this while preparing for your university exams. Now, let us see the contents that you have to include in your articulator topic. First of all, introduction and definition, history and evolution of articulators, which has been asked in one of the university papers, classification of articulators, the parts, the requirements of articulator, uses, advantages as well as limitations of articulators, some of the popular articulators in detail, and about programming of articulator, and finally conclusion and references. So before getting into detail, I request everyone to please do like and share my videos if you're finding them useful. And if you're new to this channel, please do subscribe Prosto Hub and support me. If you have any queries, any topic suggestions or any feedbacks, do comment below this video or you can mail me at this mail ID. So let's begin. Definition of articulator. As per GPT-9, it is a mechanical instrument that represents the temporomandibular joint and jaws to which maxillary and mandibular cast may be attached to simulate some or all of the mandibular movements. So, articulator simulates the mandible, the mandibular ligaments, the TMJ, muscles of mastication, and maxilla, as well as a complex neuromuscular mechanism that programs the mandibular movements. So, the primary function of an articulator is to act as a patient, because it is not practical and convenient to work exclusively in the patient's mouth at all times. So, articulators have been designed to help the dental surgeon as well as technician to study the patient's dentition and also to construct the prosthesis. And their main task is to provide a frame where it is possible to relate in three planes of space: the maxillary cast with the mandibular cast in relation to the hinge axis of the patient and of the instrument. So this is about articulator. Now let us see the history and evolution of articulators. Now coming to the history and development of articulators. So there are a wide variety of articulators that have been developed and evolved through the past years. I have selected some of the important articulators that you can remember and write for your exams. So if you want to know in detail about each and every one of these articulators, you can refer to these articles. So I have selected only 14 among them. So let's discuss in detail about these articulators. The first articulator, that is the slab articulator, and it was Philip Fabre who introduced this earliest known articulator in the year 1756, which was called as the slab articulator, also known as plaster articulators. So in this articulator, there was plaster extension on the distal portion of the maxillary and the mandibular cast that were grooved in order to fit each other. So this is known as the earliest known articulator, that is the slab articulator. Then in the year 1805, J.B. Garriott introduced the first mechanical articulator, that is the Garriott hinge joint articulator. So this articulator consisted of hinges with a set screw in the posterior against a metal plate that serves as a vertical stop. So this was the first mechanical articulator, that is Garriott hinge joint articulator. Mechanical hinge articulators were capable of functioning only in a vertical movement, and hence a need to invent articulators that could imitate the mandibular movement arose. So this was adaptable barn door hinge articulator, which had a vertical stop at the anterior end, and it was more reliable instrument than some of the hinge design. So this was the articulators where vertical stop at anterior end was introduced. Coming to the Christensen's articulator. So we know about Christensen phenomenon, which is the space that occurs between the upper and the lower occlusal surfaces during mandibular protrusion. So this Christensen phenomenon is compensated by the compensating curves. So in this Christensen's articulator, he used a protrusive interocclusal wax record which measured the angle of the condyle path, and he believed that this angle of condyle path corresponds to the observed space. So this interocclusal wax record was used to set the condyle controls of an adjustable articulator. So Christensen's procedure was a major contribution, and it is likely the origin of intraoral method of recording mandibular movement. So Christensen's phenomenon is an important viva question. In 1858, Bonwill articulator was introduced based on Bonwill's theory of occlusion. So what is Bonwill's theory and the classification of articulator based on theories of occlusion we shall be discussing in our coming slides. And the next one is the new century articulator, which was devised by George B. Snow. It was George B. Snow in 1899 who first devised the phase 4. So this articulator consisted of adjustable condyle path and also a tension spring for a greater range of movement without compromising the stability of the frame. Is Geissy Adaptable Articulator, which was devised by Alfred Geissy in 1908, and it had extra oral graphic tracings and a particular condyle path plate. But this was not accepted as it was beyond the technical ability and finances of most dentists. In 1914, Geissy's simplex was introduced as a mean value articulator which had fixed condyle guidance at 33 degrees and incisal guidance was fixed at 60 degrees. So this was probably the first one to have an incisal pin and guide assembly. So this was the mean value articulator Geissy simplex introduced in 1914. 18, George Monson developed the maxillomandibular instrument, which was based on spherical theory of occlusion. About the theories of occlusion, we'll be discussing in detail in the coming slides. So, Monson considered that the cuspal guidance were much more influential than the TMJ in regard to the jaw movements. So, this instrument permitted eccentric motion, that is, the upper member can move anterior-posteriorly as well as mediolaterally. Hanno series of articulators. So it was Rudolf L. Hanno, an engineer during the time of First World War in 1921, developed a research model called as the Hanno Model C articulator, which had provision for controlled movement with more accurate and accessible controls. Later, in 1923, he devised the kinescope, which provided exact measurement of mandibular movements. And in 1926, Hanno model H110 was introduced, and it had got individual condyle guidance adjustment in both sagittal and horizontal planes. And rather than using lateral positional records, the lateral setting was calculated by dividing the horizontal condylar inclination by 8 and adding 12 to it. That is, the formula is L is equal to H by 8 plus 12. So this is Hanno model H110. And then in 1927, this model was modified. That is, Hanno model H110 was modified, and here an incisal guide table was introduced instead of incisal guide cup. So this incisal guide table allowed for adjustments in 3 dimensions through a considerable range. 1958, Hanno H2 series were introduced, and the principal feature of this articulator was an increased distance between the upper and the lower member from 95 mm to approximately 110 mm. And in addition, the orbital indicator was also added to the upper member. And several models have come in this series, like model H2O with an orbital indicator attachment, H2X with extendable condylar shaft, and H2PR with calibrated adjustment to protrude or retrude the condylar balls up to 3 mm. The Hanno model 13021 articulator was later introduced, and the features were it had a central locking device and a mechanism to keep upper and lower members together. It had adjustable intercondylar distances, and the condylar paths and Bennett guide paths were straight. So in detail about the Hanno model, the parts, the different types, we'll be discussing in our coming slides. Next is the Bergstrom articulator, which was designed in 1950, and it was Bergstrom who first introduced the term archon, that is articulator and condyle. So archon instrument was introduced by Bergstrom, and it had similar features like that of Hanno H. So what is mean by archon articulator? So here in archon articulator, the condylar guides are on the upper member and condylar elements are on the lower member of the articulator, and the reverse is the case of non-archon articulator. So Bergstrom articulator was able to accept the phase wave record. It uses protrusive interocclusal record and also has curved condylar guidances. Next is the whip mix articulators. So in 1963, Charles Stott introduced the whip mix articulator for better diagnosis of occlusion of the natural teeth. So this was a semi-adjustable archon articulator, and it had three intercondylar distance adjustment, that is small, medium and large. So the narrowest distance was 96, intermediate was 110 and widest was 124. So this was the Whipmix articulator, and it had no centric position locking device, and the upper and the lower members cannot be attached mechanically, and the condylar and the Bennett guide paths were straight. So in detail about Whipmix articulator we'll be discussing in the coming slides. Simulator introduced by Ernest R. Granger in 1968. So it was a fully adjustable articulator and can be set from pantographic tracings, positional records and other tracings. So there were curved condylar path, but the unique feature of this articulator was that the condylar path rotates inwardly. It has a broken axis and also a mechanical timing element which combine to reproduce mechanically the Bennett moment and also the Fisher's angle, and the condylar path locks can be released in simulator so that the upper member can be separated from the lower member, and the incisal guide pin was curved. So these were the features of simulator, which is a fully adjustable articulator. Articulators developed by Cavo Company, which offers good precision, they are cost effective and provides superior handling. So four models have been introduced like the Protar, Protar 3, 5, 7 and the latest model is Protar 9. So the Protar 9 is having an adjustable protrusion, distraction as well as retrusion. Coming to the virtual articulator, which is the latest breakthrough in the world of articulators. So this system not only simulates the TMJ movements in the modeling software, but also it allows the dental technician to take the measurements of his or her own articulator and to scan it and to add these data to the software database. So the articulator dimensions will be saved in the software so as to be able to virtually articulate the models. So this is the latest among the articulators. Completed discussing the evolution of articulators. Actually, we have only selected very few articulators and there are many more that can be added to the list. So this large number and great range in the complexity of these articulators can mislead the dentist into thinking that the choice of a suitable instrument is difficult according to the situation. However, the choice actually depends upon what records can be obtained accurately and what the instrument needs to do, and also the fact that articulator technology is not a substitute for a biological understanding of the masticatory system. So the emerging understanding of the neurophysiology of the mandibular movements as well as influence of several morphological and behavioral consideration proves that each patient is his or her own best articulator, and the success or failure of the final restoration actually depends on the operator of the articulator than the articulator itself. So this articulator controversy was summed up by Boucher by the statement that it must be recognized that the person operating the instrument is more important than the instrument. So if dentists understand articulators and their deficiencies, they can compensate for their inherent inadequacies. So here comes the end of the current session, and thank you all for watching my video. Please do like, share my videos, and please do subscribe to my channel if you are finding these videos useful. And if you have any queries, topic suggestions or feedbacks, you can comment below this video or you can mail me at this mail ID. So let's see in our next session with the second part.